During your exam, you'll be asked oral questions. Now, these normally are 3 oral questions, and the examiner will ask you while you're doing your full body massage. You'd normally put your hands on the client, look at the examiner, stop what you're doing, and answer the questions. Now, recently, the questions have been definitely a muscle question, possibly asking you what the action of the muscles you're working on are. We've also had questions about the bones of the lower leg and foot, the bones of the lower hand and lower arm. So please make sure that you know all of the muscles in the body before you take your exam, and the bones as well. You might get a contraindication question, and that might be in the form of, tell me all the contraindications of the lower leg and foot. It might be contraindications of a stomach massage. It might be contraindications of the head, face and neck. So have a look at the contraindications again, refresh your memory and make sure you know each individual area. We haven't covered first aid on this course. It is assumed that all massage therapists will do a first aid course and have it updated, but I have just put some of the type of questions you might be asked during your exam. We haven't had a first aid question for quite a while, so it's just for your revision really. Massage movements. Please have a look at the different movements. What does effleurage do? What movement are you doing there? That's the type of question you might get about your massage movements. Also, your lymph nodes, where are you draining on that particular area? So if you were on the shoulders, you might be draining to the cervical lymph nodes or the lymph nodes under the armpit, which are the axillary lymph nodes. So do make sure you know your lymph nodes and where you're draining. The consultation process, you might have a question, why do we take a consultation? What sort of situation would you do a consultation in? So you'd want a private area to ask people questions. You want a neutral body language, so you might just sit next to them rather than opposite a desk. Client information, what information have you got about this client? What do they do? So sometimes it's about reading your consultation form. Do you know what your client does for a living? Have they got any contraindications to concern you? Like a varicose vein you might have to avoid. And what home care advice are you going to give this client? So do have a think prior to the exam. You'll have met your client for half an hour before the exam, so do make sure that you think about what home care you're going to give for this person, what diet, exercise and relaxation advice you're going to give. Professionalism, why wouldn't you wear lipstick? Why wouldn't you wear perfume, things like that? What would it be unprofessional for you to do? Any aspect really relating to the client's well-being and your treatment could be asked, but these are the most common areas. It is assumed that if you've got a client with asthma, that you would make sure they kept their inhaler handy and that they brought it with them for each appointment. If a client is having an asthmatic attack, then you would reassure the patient, sit them up, leaning them slightly forward, resting on a firm surface, like maybe your couch or supported with a pillow. If it's their first attack, you're certainly going to seek medical attention. If they have an inhaler, you're going to get the inhaler out of their bag or out of their pocket, and they should have a good puff of the inhaler, and after 3 minutes, you need to use the inhaler again. So that's the key amount of time, is 3 minutes, breathing deeply and slowly. But if the attack is severe and the inhaler has no effect after 5 minutes and the client's getting worse, then you should ring 999. This is a life-threatening condition, particularly if somebody hasn't had an asthmatic attack before or their inhaler doesn't seem to be working. I would ring 999. So you might be asked what you would do if a client had a nosebleed while you were in the treatment room. You're going to sit the client down, lean them slightly forward, get them to breathe through their mouth and pinch the soft end of their nose for 10 minutes. Give them a clean cloth or tissue, and after 10 minutes, if the bleeding hasn't stopped, then you're going to reapply the pressure for a further 2 bouts of 10 minutes. After 30 minutes, if the nosebleed hasn't stopped, then you would seek medical attention. If the nosebleed does stop, then you're going to ask your client not to blow their nose for the rest of the day, to dislodge the clot that's formed in the nose. I've had a lot of nosebleeds over my lifetime, and it looks like a lot of blood, and sometimes it does take a long time to stop. So leaning forward, fleshy part of the nose, maybe a bowl or a tissue to catch the blood in. Fainting or dizziness, funnily enough, I have had a client get off the couch a bit too quickly and collapse in a heap on the floor. So you do need to know that if somebody faints, it is a temporary unconsciousness resulting in an inadequate blood supply to the brain. So the symptoms, they might have slightly blurred vision, they might feel nauseous, they might be slightly pale or green, they might be sweating. So you're going to lie the client down on their back, elevate their feet, either kneel or support the ankles or have the ankles on your shoulder. Lots of fresh air, so loosen clothing, reassure the patient that everything's going to be okay, and the patient should make a rapid and complete recovery. If not, you should seek hospital treatment if you suspect it's something more serious. If you suspect your client's having a heart attack, they might have severe chest pain, dizziness, they might just collapse, have shortness of breath. If they're unconscious, you're going to put them in the recovery position. They might have a weak, irregular pulse. So initially, you've got to sit the client down, prop them up, and bring their knees up to their chest slightly, which takes the pressure off the heart. Dial 999 for help. Make sure that the casualty is comfortable, and you've got a pillow behind their head. If they become unconscious, then you are going to ring 999 and put them in the recovery position. But if they're fully conscious, then you can give them 300 milligrams of aspirin to chew, which might alleviate the symptoms. Otherwise, if you know if there's a defibrillator in the area, you could send somebody to get a defibrillator. But it is important that therapists do undergo a first aid at work certificate, and some professional bodies do insist that you have a first aid certificate.